Most people have had some illness that requires them to take antibiotic medication to combat the bacteria. But have you ever stopped to think about where these medications were first created, or what we would do if we didn't have them? According to an article on infections in the Better Health government website, most bacterial diseases can be treated with antibiotics. But what if these antibiotics were unknown to us? Alexander Fleming changed the world of medicine through his research and his discovery of the first antibiotic, penicillin. Being a pre-pharmacy student and interested in the history of medicine, it intrigued me to want to learn more about the medicine and do research and explore how they first came to be. Alexander Fleming changed the world of medicine through his work as a student, a professor, his research, and through his discoveries. Before discussing Fleming's discovery, it is important to know of his work as a student and professor of bacteriology. Fleming attended St. Mary's Medical School in London. He qualified with distinction in 1906, and 2 short years later, he won the prize of gold medal as the top medical student at the University of London. He graduated in 1908 with a Bachelor in Medicine and a Bachelor in Surgery. He was able to continue his studies through his military career. In the military, he was the captain in the Army Medical Corps and studied wound infections. It was while in the military that he became so intrigued with the bacteria and their potential effects when left untreated. During this time, Fleming established a successful private practice treating STDs. Fleming was one of the first doctors in Britain to administer salvarsan, a drug effective against syphilis. After his service in the military, he returned back to St. Mary's. Fleming worked as a professor at St. Mary's Medical School in London in 1928. Following, he worked as an assistant director of inoculation department and eventually became principal of the department. According to the article on Fleming on nobelprize.org, he was the emeritus professor of 1948. In other words, he retired with great honor after 20 years of teaching. Although Fleming's work as a professor inspired many, it was his research that led him to his many accomplishments. Fleming's research began while at St. Mary's under Sir Almroth Wright, who was a pioneer in vaccine therapy. It was working with Wright and due to his research that he was able to administer treatment to his patients in the form of vaccines. Fleming's research was, while in the military, focused on bacteria and that cause common diseases such as gangrene, one of the biggest killers in the Army campground. His research showed that bacteria were able to grow even when oxygen was not present. This was because the antisepsis that the body naturally created did not reach the area, and the condition continued harming cells that were defending the body. Although plenty controversial at the time, Fleming was the first to recognize that in order for the wound to heal, the diseased tissue needed to be cut away. Early in his medical life, Fleming became interested in the natural bacterial action of blood and in antisepsis. He was intrigued by how bacteria affected the body and the body's natural way of defending itself in minor situations. However, he noticed that when the bacteria was too large, the natural antisepsis of the body was not enough to save the person. Fleming wanted to find a solution to this. He wanted to find something that would mimic the body's natural response to bacteria. Most of his research was on antibacterial substances which would not be toxic to human or to animal tissue. All of the research Fleming did eventually paid off for mankind. All of his discoveries impacted the world greatly. In 1921, he discovered a secretion made by the human body, which he named lysosome. Lysosome has a chemical component that dissolves bacteria present in the body. He discovered that this substance contained a percentage of antisepsis that was not potent enough to destroy pathogenic bacteria. In other words, it was not strong enough to kill the bacteria that made us sick. The discovery of lysosome was a significant contribution to the understanding of how the body fights infections. Later, he devised a titration method and began to analyze human blood and other body fluids. This titration method is used to determine how much medication could be given to a patient without further damaging the patient. It is still commonly used when determining how much medication a patient should take. His most significant discovery was penicillin. In working with petri dishes, Fleming began to culture bacteria in order to learn more about them. To his surprise, one of the petri dishes began to grow a mold that would suppress the harmful bacteria. This mold was recognized to be one of the many types of penicillin. This led to more research and testing of the penicillin strand. According to Kevin Brown of Encyclopedia Britannica, Alexander Fleming that if the penicillin were to be purified, then it would work as a topical antiseptic and as an injectable antibiotic. However, Alexander Fleming was not able to purify the penicillin on his own. With two colleagues, he was later able to do this, and penicillin was later able to be distributed as medication. To conclude, Alexander Fleming is one of the principal figures behind the creation of the first antibiotic. Without all the hours of research performed by Alexander Fleming, most ailments that we now consider to be minor medical issues would go untreated, and countless patients would lose their lives on a daily basis of things like strep throat. If not for the work of Alexander Fleming, the medical world would be completely different today, lacking knowledge and advancements in things that we pay no attention to today. Had it not been for the countless hours of studying, teaching, and performing research studies, we would not be able to reap the benefits of his amazing discoveries. Not only did Alexander Fleming receive a Nobel Prize in 1945 for his outstanding work and contribution to the medical field, he was able to save 1,000 lives due to his work, and since his passing, he has been able to save millions more.